we are representing MySphera. This picture is a hospital in Liverpool, the Allerhay Children's Hospital, and it's a motivational hospital for us because it was driving innovation and transformation in healthcare. Yeah, can we move to the next slide? So yeah, MySphera, it's been there for more than 10 years with the aim of improving hospital processes by using IoT technologies. We have a patient tracking solution that helps to follow the patient journeys. And with that, we provide real-time applications for the hospital. Yeah, if we move to the next one. So we identified the problem of bad coordination in big, medium-sized hospitals. That was something that is common still in big organizations. Important processes like the emergency department process, the surgical process, and other demanding processes in the hospital involve many different teams. And if we move to the next slide. Yeah, that involves different teams in the same process and coordination and communication with these teams that are separated in big distances is not really good. And there's still a lot of phone calls or shouting at the corridor to find the patient or the porter or to find important equipment. So we came up with this solution of tracking the important assets or patients along the process and providing this real-time information. We were doing this with a Bluetooth tag and a Bluetooth gateway, and that was providing the real-time journey of patients or equipment, and that was sent to a platform that was serving real-time application for the different people participating in the process. That was pretty much improving coordination of the different stakeholders participating in the process that we wanted to play. If we move to the next slide, please. So in this way, each team in the process, so for example, this is the surgical process, you would have admission, you would have the preparation area, you would have the operating theaters, then the recovery areas, and then hospitalization or discharge. Each of these teams would have a real-time application being fed by this real-time information, and they will coordinate much better with this solution. Currently, it's still done pretty manual, and then for the manual situations, it's working poorly. Yeah, the next one. So for us, after having this solution, we needed to tackle the public market to validate that we were really attracting our customers. Thanks to the InnoMatch project, we were able to deploy this solution and validate this solution in the hospital clinic in Valencia. And also, as a result of that, that was really helping us to attract other important hospitals, one in Paris, the Clinic Saint Joseph, and we are now working with another hospital in Catalonia, Parc Taulí. So that was really useful just to start the traction. And as well as that, we identified an important public procurement in our sector also for optimizing health and care resources. That was because an instrument from the EAC, the spin for EAC, basically make us aware of this public tender. So we applied and we were able to win these bids and then develop a new solution on this scheme. But I think I'll probably tell a little bit more later on. So I guess, yeah, we can leave it there.